This is Dr. Sonia Dhoot, and you're watching this video today because you have been diagnosed with a posterior vitreous detachment, or a PVD. In the back of the eye, there's a jelly called the vitreous, and when we're born, that vitreous is really solid and it's firmly attached to our retina, which is like the wallpaper or the nerve tissue in the back of the eye. As we get older, that vitreous jelly becomes less solid and more liquefied, and eventually separates from the back wall of the eye. That process is known as a posterior vitreous detachment. When that posterior vitreous detachment occurs, you may experience floaters or flashing in the eye, and sometimes both. As long as that vitreous jelly separates safely, which it does 85% of the time, it's no big deal, and usually with time, your flashes and floaters slowly get better. 15% of the time, however, the vitreous jelly can cause a retinal tear as it's separating. If that happens, that's an emergency and we have to laser the tear right away. Otherwise, it can turn into a retinal detachment, which is a potentially blinding condition. So when we notice that you have a posterior vitreous detachment, we like to see you back in about 4 to 6 weeks, assuming there is no tear on your exam today. The jelly takes about 4 to 6 weeks to separate, so that's the highest risk window of ripping a tear if you're going to rip one. So after your visit today, if you have any change in your floaters or flashing, if they get worse than what you're currently seeing, please call the office right away so we can schedule an appointment to make sure you have not torn the retina. Otherwise, we do recommend being examined in that eye again in about 4 to 6 weeks, even if your symptoms are improving. Between now and your follow-up visit, you do not have any restrictions in terms of physical activity, just only to watch to make sure your symptoms don't worsen.